With us, Dr. Victor Emmanuel. He's Hyderabad-based doctor and he charges only 10 rupees from his patients as his consultancy fees. Very well, welcome to NDTV, doctor. My first question, what made you start this initiative? Why only 10 rupees?
Well, Mr. Arun, it's a proud moment for me to be on NDTV. See, a lot of people keep asking me the same question. Well, I must say that, I must say that around 12 years or ago or so, I have seen a lady, a patient actually, a patient's wife, begging on the road so that she can buy medicines for her husband. That has been a defining moment in my life actually. That's when I have taken decision to serve the poor and needy at the lowest possible rates. And yes, I mean, see, there are a lot of other inspirations, like whether it is my father or my friends or my wife who keeps on continuously supporting me in this initiative to serve the poor and the needy. Many people have asked me that 10 rupee carries no value in today's world, but I don't agree with them when I especially look at the poor and needy people, who, especially during this pandemic, I've seen many people struggling a lot because of loss of employment and loss of business, other things. And
And
also,
you've kept this fees because you want them to feel dignified while they come to you.
yes, that is,
And you
yes.
don't do it for free.
Yes, I don't want anybody who leaves my clinic or hospital with a feeling that they have received the treatment at somebody's mercy. But in fact, I want them to feel that they have paid something according to their own capacity, and I want them to leave my hospital with a self-respect that they got the treatment with whatever amount that they could pay.
Hmm. And also, but as a token of appreciation, you charge, I mean, you don't even charge 10 rupees from farmers and Jawans. Tell us about that.
Yes, I mean, my father himself has been an ex-serviceman. And see, apart from poor and needy, there are certain categories that we do serve at our clinic. Like, it's not based on their financial background, but because what they have done and what they continue to do to our country, like farmers who feed the whole country, and also our soldiers who continue to protect us. It's a mark of, it's a gesture, to appreciate the work that they are doing.
Right. And what is your day like? When do you start and how can someone really contact you?
Well, during this pandemic time, it has been, I mean, absolutely busy schedule. My day used to start at early morning 6 o'clock, and we do have a COVID center where we do treat patients for free of charge. It's a 30-bedded capacity. My rounds, at the COVID center start at around 7 a.m. in the morning, and it continues to till 9. And I get back to my clinic at around 10 or so, where we'll be continuously seeing the patients. Sometimes till midnight or so. Because now the number of cases have come down. But when the second wave was at its peak, on some days, we used to see around 150 to 160 patients, and I remember the days when we had to close down the clinic at midnight, 12:30 or 1.
Oh, I really appreciate your efforts, doctor. Also, there is a bit of vaccine hesitancy amongst people. As a doctor, what would you tell people who are still hesitant? And it's also National Doctors' Day. So on this day, what do you want to say to those who are a little hesitant today as well?
See, I mean, there are a lot of misapprehensions about the vaccine, but I request and urge all the people that we cannot defeat the COVID unless all of us, I mean, majority of us do receive the vaccine, whether it is the infection or the vaccine that is going to get the maximum number of people actually. So better we vaccinate ourselves at the earliest, like, we can avoid the COVID disease.
Okay, lastly, uh, how can someone contact you in Hyderabad, let's say, because you're based out of Hyderabad, right? And what can do they come to you for their general problems or should they come to you for any specific one?
They do come. Since I am a consultant physician, they come with all kinds of troubles. Yes, I do address all the general issues, and Since the COVID was there for the past 2 months or so, most of them used to be COVID patients. But otherwise, on regular days when COVID is not there, I see all patients.
How can they reach you, doctor?
Well, I practice at Prajwala Clinics at Medipal in Hyderabad. And also, shortly we are going to open a hospital, which is again going to be a charity hospital. It's going to be named again Prajwala Hospitals, where our main motto and intention is to serve the poor and needy.
Okay, because pandemic led a lot of doctors take e-consultations. They used to see their clients, they used to see their patients through video conferencing. Do you plan to do that to maybe take it to the national level?
Well, somehow, intentionally I had opted out of it because, practically there were so many patients here to be seen, who come on a daily basis, and I had to see them physically, all of them. You see, so because of that, I couldn't get time to go online to do online consultations.
Right, but thank you so very much. I really appreciate the effort that you are doing. And lastly, a very happy National Doctors Day. Thank you, doctor.
Thanks a lot, Arun. Thank you.